In this video, I will be discussing about the clinical examinations that you need to perform while performing a ear, nose, throat examination. So, first let's talk about the setup of it. As you can see, before again, it is very important to have a proper informed consent so that the patient knows exactly what you are going to perform, and that way if you take a proper consent, the patient examining the patient will become a whole lot easier. So coming to the setup that you need to have, as you can see, the behind the patient, that is the bull's eye lamp, which is placed behind the patient and on his left, just above the left shoulder. So the light from the bull's lamp is coming onto the head mirror which I am wearing, so that light from the head mirror is now getting reflected onto the part of the patient that I want to examine. So this and important thing, another important thing, that the although in this room the ambient light is quite a lot, preferably it should be a dimly lit room so that the light reflected from your head mirror is highlighted more. So let's progress. So now first I'll show you how you will examine the ear with a bull's lamp head mirror, and initially I'll examine the external auditory canal and if possible the tympanic membrane without a oral speculum. Then I'll examine with a oral speculum. So first I'll turn the patient. So see, I'm examining the left ear, so I'll turn the head of the patient to the patient's right so that the left ear of the patient faces me. Now again, the light from the bull's lamp has been reflected by the head mirror onto the external auditory canal of the patient, and see, I have pulled the pinna upwards, backwards and laterally to straighten the cartilaginous canal and align it with the bony canal so that I can see far inside and if possible even the tympanic membrane. See, that is how I am examining without a speculum. Now to examine the ear with speculum, it will be absolutely similar. The pinna has been pulled upwards, backwards and laterally, and the speculum has been introduced. So that will give you a better view of the external auditory canal as well as the tympanic membrane. So I'll repeat the same thing on the right side. See, I have turned the patient's head to the left and I have pulled the pinna upwards, backwards and laterally. So now I'll introduce the speculum, and see, that is how you examine the external auditory canal and the tympanic membrane. So now I'll show you how to use a lax tongue depressor to examine the oral cavity, the tonsillar fossa, anterior and posterior pillars, and the posterior pharyngeal wall, and even to see the uh, palatal reflex, palatal movement. So see, when you are depressing the tongue with the lax tongue depressor, it is important to stick to the anterior two-third so that the gag reflex is not initiated. See, there is no gagging of the patient because I have only depressed the anterior two-third with the depressor. See, you can see the tonsillar fossa on the right side, see the uvula, and I am asking the patient to move his palate as well. So coming to indirect laryngoscopy. So the setup will again be the same, like a bullseye lamp. The light is coming onto your head mirror, and now see, have a careful look at my fingers. So my thumb and my middle finger are holding the tongue down with a gauge piece, and my index finger is lifting the upper lip. So now, before introduction of the indirect laryngoscopy mirror, it is important to increase the temperature of the mirror to the core body temperature. So it should ideally be put in boiled water and then dried so that there is no fogging of the mirror. So see, now I will introduce the indirect laryngoscopy mirror and hinge it on the uvula and soft palate, taking care not to touch the posterior one-third of the tongue or the posterior pharyngeal wall. See, that is the position of indirect laryngoscopy. Now coming to anterior rhinoscopy. See again, it is a repetition, but I'll still say again, you need the bullseye lamp, you need the head mirror, and you need a thudicum's nasal speculum, which I am holding. See the fashion, I am holding the thudicum nasal speculum in my non-dominant hand, so that my right hand is free to perform any procedure if necessary. Suppose while removing a foreign body, we can use the Tilly's forceps or perhaps a nasal foreign body hook to remove a foreign body from the nose. For that, our right hand is free. So see how I have held the thudicum nasal speculum in my left hand. So after focusing the light, see, that is how you dilate the external nares so that you can have a good look inside. You need to know the structures that you can normally see in a by anterior rhinoscopy. So normally you can obviously see the vestibule and the anterior part of the nasal septum, and inferior turbinate is always visible. If you are lucky, you may be able to see the middle turbinate as well. So that is anterior rhinoscopy. Now coming to posterior rhinoscopy. See again, the bull's lamp is reflecting the light from the bull's lamp via the head mirror onto the throat of the patient. So you need a tongue depressor for this procedure. So I'll depress the tongue like I said before. I'll depress the anterior 2/3 of the tongue. Then I'll introduce the PNS mirror. Again, this should be a preheated PNS mirror by dipping it into boiled water and then drying it, so that the temperature is raised and there is no fogging of the mirror. See, then I'll introduce the PNS mirror like that, in that fashion. So since the patient's uvula is getting in the way, it is a little difficult to perform the PNS in posterior rhinoscopy. See, the patient lifted his hand because his gag reflex was activated. So here also it is important to take a proper consent. As the patient was informed properly about the procedure, he could show that he was having a discomfort. So even just at the point I touched the posterior pharyngeal wall, he lifted up his hand as his gag reflex was initiated. So that is how you perform the common clinical examinations while performing a detailed ear, nose and throat examination.